Evaluation of chest pain based on USMLE Step 2 CK guidelines. Whenever you see a patient with chest pain, you suddenly realize that whether this patient is coming due to a cardiac cause or a non-cardiac cause. This is the first thing that's gonna counter your brain. So to settle this question, we divide the chest pain into three categories as far as heart is concerned. Is it a typical, atypical, or non-anginal chest pain? In order to meet typical chest pain criteria, the patient's chest pain must meet three characteristics: typical location, typical provocation, and relief. For typical location, we can say the patient may have retrosternal chest pain. The cardiac chest pain must be provoked by exercise or stress. Classic chest pain is relieved by rest or by taking nitroglycerin. So if a typical cardiac chest pain meets all these criteria, we call this classic or typical chest pain. If a patient meets two of the three criteria just discussed, we will call it atypical cardiac chest pain. If a patient has only one criteria or less than two criteria, we call it non-anginal chest pain. So based on these criteria, you allocate the patient towards typical, also known as classic chest pain, or atypical chest pain, or non-anginal cardiac chest pain. Once you decided that the patient falls into typical, atypical, or anginal chest pain, you can apply the classic USMLE Step 2 CK algorithm. Based on the evaluation of chest pain, USMLE Step 2 CK algorithm, you classify the patient as low, intermediate, or high risk patient. If the patient falls in high risk chest pain category, immediate pharmacotherapy should be initiated for coronary atherosclerotic disease. The most important point regarding the evaluation of chest pain is if the patient has non-anginal chest pain, means patient's chest pain cannot fill those three characteristics and have less than two of those criteria. We will call this non-anginal chest pain, and patient will fall into a low risk category. So no further testing will be required for such patients. If a patient meets all those three characteristics for a typical chest pain, we will call it a high risk patient. Immediate pharmacotherapy should be given to this patient for coronary atherosclerotic disease, and expert consultation should be initiated. Now if patient has two of those characteristics for his chest pain, we call it atypical chest pain, and the patient will fall into intermediate